Excited to have a different kind of guest on this week's episode of New England Take. I'm joined by today John F. Williams of Portsmouth Orthopedics, port-ortho.com. His business is one of the recipients of the Citizens Bank Small Business Community Champion Award, which comes with a $10,000 grant to support his business, which is a lot of work with veterans. He himself is a veteran, and I'm excited to talk to him about his background and the work he's doing over there, and his hopes are for the future using this grant money. John, thank you so much for joining me today, and thank you for your service.
Thank you so much. It's happy to be here.
So, for starters, I mean, let's start off with your background was as a Navy corpsman. What led you into service in this parallel journey into medicine?
Well, it's been a long journey. So I did start as a corpsman in the Navy, spent 5 years there, and just kind of worked my way through. I was a combat medic. And worked with some of the special force units overseas, and then got into assisting in orthopedic surgery. And when I got out of the Navy after 5 years, I knew this is something I wanted to do, was help people. And, so it started as something I had a lot of energy. I was real excited about the training I had in the Navy. And so when I got out, I partnered with an orthopedic surgeon and started a durable medical equipment company, and then went on from there to get additional training. I trained up at Northwestern Medical School, and then as an orthotist, got board certified, and also at University of Michigan in ergonomics, and finished a degree from Southern Illinois University in healthcare administration. So I kind of understand the management aspect, the insurance aspect of healthcare, and how difficult it is for most people to navigate through the system itself. And I got to a place where I could, establish my own facility, which is what I did out here in the Seacoast area at Portsmouth. I came from California a year ago. My parents retired here, and my brother and his wife, my sister-in-law is a physician here in Portsmouth, and they came here 10 years ago, and it's just so beautiful. I go hiking with my mom every year in Acadia for the last 15 years, and I just knew someday this is where I wanted to come and set up practice and eventually retire. So in terms of the medical part of it, I wanted to run a business that wasn't a business. It was more about the patient and how to focus on the patient. And I understand how difficult it is with copays, deductibles, insurance. And as a veteran, I use the VA. They're my primary medical source. And it's very difficult once you do get in with primary care to go in and see the specialist. You have to go see an orthopedic surgeon or a neurologist or somebody that then can refer you to an orthotic prosthetist. And so that it's easy to get in to see a primary usually, but it's much more difficult as you get through specialties. And so I just saw all the holes in the system and wanted to come in and start filling some of those. And so providing mobile services for patients, within a 30 to 40 mile radius of Portsmouth, and then also working with patients that can't afford, to pay their deductibles or their copays. And so I've never refused a patient. Obviously, if it's a very expensive prosthetic leg, those are things we would have to work to try to, raise money to assist in. But I see patients. I don't charge for assessments. I don't charge to go to their homes. I work out of 4 of the 5 wound care centers as their primary orthotist, and supporting diabetic wound care, foot prosthetics, neuropathy. I see a lot of patients that have MS and, Parkinson's, and have had strokes. And so these patients are usually, rehab hospitals, nursing homes. And so I will travel to go see them at a nursing home or rehab facility. I do that. I'll go see them at their home, but mostly I'll see patients at another clinic or at my office. So I try to bring as much flexibility to the atmosphere of healthcare, which is, can be traumatizing sometimes for a lot of people. especially people that are hurt and injured and don't understand how, complicated the system can be.
And
And
you're literally adding something physical to their body that they did not have on their body on a daily basis before. I mean, that must be a very dramatic life change, both good and confusing, I'd bet.
it can be. And yeah, I mean, it's a process. When I evaluate the patient, the most important thing is to look at them from a holistic standpoint. In other words, the full process of what it is, their ADL during the day, what is it we're trying to achieve. And I'm not just focused on, oh, okay, I'm going to see this patient because they had a foot amputation, and that's all I'm going to focus on. I'm going to focus on the whole process of what they need. And so I purposely set up 1 hour visits for all my new patients. And again, I provide the assessments at no charge. So, it's to me, it's about trying to find what works best for the patient, because ultimately they're going to keep coming back, and you want to be able to improve their lives. That's the primary goal. And so to me, my practice isn't about me. It's really about the patient. And I believe that, and I stand by it. So,
That's great. And I want to also we'll talk about veterans specifically in a minute, but
sure.
specifically for civilians in rural New Hampshire, for the most part, dealing with private medical insurance. I mean, I'd imagine it's very important that there's someone who's based in New Hampshire with regards to where your carriers are in network and out of network, and where the borders of where your coverage is going to allow. It must be very important that someone is here in New Hampshire doing this.
Well, and there was a big vacuum. That's one of the reasons why I set up practice here. Is a lot of practitioners quit providing lower extremity orthotics, orthopedic shoes for diabetics, that kind of thing, because it became such a administrative nightmare for a lot of people. And so I try to bring that back. I mean, patients that have diabetes that are on Medicare are allowed a pair of shoes and custom diabetic inserts every year to help protect their feet. Most of them have neuropathy, they have edema, they struggle from other associated diseases because they have diabetes, and then it affects them. If you can't walk properly, or if you have an ulcer that's going to turn into something, a bone infection, which is very typical, we're trying to prevent those things from happening. Or if it has happened, to let them know what's available. Only 3% of diabetic Medicare patients utilize the fact that they can get shoes and inserts that are covered by Medicare. And so for me, it's important to educate the patient, the community, just to let them know that this is available to them, but then also to let the patients know it's so important to do this. It's amazing how simple prevention things can save you a lot of money, time, energy, and your life expectancy.
Are primary care doctors not aware necessarily that this is that something that is available to their patients, or is it just something that's kind of outside of the realm of what they treat?
I think some of them, well, probably most of them are. I just think it gets away from the patient of how valuable this resource that the government provides is. Um, and I for primary, it's usually they have diabetes type 2, or all kinds of different arthritis conditions, and they just, I don't know, for some reason it just seems like there's a lack of knowledge about what's available, and it's not that complicated. But also, up until the time I started this practice a year ago, most patients had to go 60 miles plus to go see somebody. And there's only one other orthotic prosthetic organization here in Portsmouth, which do a really good job. They've been here for a while. They have a good team, but they don't really provide these services. And they definitely, I guess from my standpoint, I take such a personal approach to my practice that, we're kind of in a different segment, I guess. And all the way up and down the seacoast, there's so much opportunity for patients to be able to benefit from a lot of these services. The other thing that's really unique is because we can provide mobile services. We have, state of the art technology when it comes to scanning. So we don't have to cast very often. We can if we need to, but I can scan an extremity and order a custom device for a patient and usually fit them within 2 weeks. And so they're not waiting months. I can get them in within a week, if not sooner. I can evaluate them. If it looks good and we're moving forward, then I can get them fitted and get them on their way in a device that is going to work for them. I have patients that come in, a lot of veterans, in fact, that have custom AFOs or off the shelf ankle foot orthotics to help with foot drop. And they're broken. They're falling apart. They haven't been able to find somebody to take care of them, or just they have to. And the only way they can walk comfortably and have balance and safely be able to, go through their day is to have these devices. And so I worked with OSER International, which is probably one of the largest orthotic prosthetic companies in the world. And when I was in Southern California, I worked out at the corporate office and headed up, quite a few of the O&P services that we provide, and worked with a lot of the professional athletes with Curlin Jobe, Cedar Sinai, and it's a pretty big name in hospital services. But I also did a lot of imaging care with UCLA and USC. And we had patients that would come in with no socks on, that have ulcers. And so I just found that it's so rewarding just to do the right thing. And when you don't base your practice around a financial model, it's based around the patient model, the rest will happen, right? I don't need to, go buy a country. I just want to be able to provide services to as many patients that need it. And that's really how I feel about it. I've had a good career, and this is my time to really give back.
Now, what specifically, when it comes to veterans and their families, are unique that maybe either it's certain injuries that they have, or it's emotional difficulties with regards to care that someone who's been in the service is able to address better than maybe some civilians?
Yeah, no, it's a great question. I mean, because I see it all the time, and I really reach out to veterans families, people coming back from the war that have been overseas and been in combat. The traditional outlook is, well, they need a prosthetic. That's kind of the usual game. But outside of that, most of these patients have the same healthcare problems, obviously, that anybody else has. And the problem that they have with the VA is once you hit that specialty mark where you do need a custom device, the VA is backed up. We have a great VA system in Manchester, and they've done a good job of getting satellite offices opened up over the last few years in this area. And they do a good job with scheduling initial visits, but it's really hard to stay consistent in a timely manner to take care of their patients. And they have an outside network called CCN that they use, continuing care network that the VA uses. And they just look at a system to add providers to this network, and they're lacking. There's only 10,000 orthotists, prosthetists in the country. There's only 13 schools that provide training. So there's a huge shortage. And the VA, because of administrative issues and maybe political issues, doesn't open this channel up to really look at how they can be helpful. I mean, for example, with mobile services, there's nobody providing mobile services in this area but me in the whole area. And so, I mean, not really, but like, for example, I've requested, for a year to get put on the CCN network, and they just look at their screen and they go, well, there's just, we don't have any openings. And it's like, look, I'm just trying to service these patients, I said, there's a huge demand here. Eventually we'll get there, but it's going to take me working with the VA, I think, more and more, and I'm definitely willing to do that. And it's not about stepping on anybody's toes. It's just about being able to provide that service that at the convenience of the patient, so they're not waiting. And at the same time, um, a lot of these people are fixed income. A lot of them are older if they're retirees. If they're disabled, a lot of them can't come in. They don't drive. They need somebody to drive them. And so, we try to just go out of our way to understand that and to try to work with them to see as many patients that we can in terms of being a service. And so we try to push through those barriers. I will see patients that I'm not going to get reimbursed on, and this isn't patting myself on the back, but the point is, I just want to be able to help as many people as I can. And so there's obviously barriers like that, but we will push through that.
Well, I'll pat you on the back. It's amazing that you're doing this, especially I grew up
Well,
in
thank you.
Maine. I've lived in New Hampshire
Okay.
for God, at least 16 years now.
Oh, wow.
Rural states are a different situation. There's no
Yeah.
public transport. It's not easy to
Yep.
necessarily get from point A to point B. There's not necessarily a person on the corner that's able to just answer your questions and such. For starters, if you are a veteran and you're having questions about your coverage and things like that, is there a specific place that they should go to look for that help?
Well, I mean, the first objective I would think would be to make sure that they're registered with the VA, so they do have that baseline of healthcare with the VA. But at the same time, I see VA patients, and I will get reimbursed in certain situations. It's just there's just paperwork that's involved, and it's a real hassle. Um, but if patients call my office, I'll give them a free assessment either over the phone, or we'll do a telehealth visit where they can come in and talk to me. They can bring their old braces. They can, whatever questions they have. Usually most people that I see will come in with a family member, which is wonderful because you get to educate the team, so to speak, you know? And so patients either call, I have 24-hour answering service, or they'll send an email, or they can even go online to our website and schedule that way if they want. So we've tried to make this as convenient as possible. A lot of older people have a hard time with some of the technology, and so they can't fill out all the forms online. That's okay. We'll do that for them. Um, and so I'll tell you the most interesting part of this up until this point so far has just been the amazing people in this community that I've met. It is, I mean, you're very fortunate that you've lived here as long as you have, the way I look at it, because it really is an amazing community. I've fallen in love with these patients. I mean, it is, it's 99% positive, and it just gives me more energy to keep going and see what I can do.
So, what's your plans for the future? So you haven't been in the state that long. I mean,
Yeah,
going forward, especially with this grant, what are your
yeah,
grand plans?
yeah. So the grant we already have plans for, essentially, and we're very grateful to Citizens Bank and being able to apply, and very surprised that we became the winners. But we've started a campaign that actually starts this week. I'm going to double check tomorrow, but we've been working on it for about 2 months to really start educating the public as to what's available to them and the opportunities that they have, that Medicare covers in terms of services. Same thing with VAs, letting people know you don't have to wait 6 months to get a brace. We will help you do it. And even if you use somebody else, that's fine. If we have resources to be able to assist and let them know, then that's wonderful. Because to me, it's about the end result. It's not about, getting a device to bill. And so the goal ultimately is to try to spend is so for the money standpoint is really it's going to be a campaign of educating the public as much as we can. Um, and whatever's left over, I guess we'll go to copays and deductibles that patients can't pay. I have it on my website and it's in writing. If somebody can't afford something, we will work with them however we have to work with them to try to make it work. And you just don't see that in healthcare today. Everybody is so busy, tied up, doing all the things that they have to do. And then when you're sick or you have a disease, and you brought up the psychological part. It's very, it's demanding on yourself, and depression is very common. And anxiety about, like you discussed, wearing a new brace or having your body has to get used to it. And so it's important to spend the time with the patients, educate them. And then, so I'm really hoping that, we can get the word out in a pretty good start over the next 2 months with this. And we're Medicare accredited. We just finally got our Medicare numbers. So it literally took a year. And I've been seeing all these patients that I can't bill for. So, and that's okay. Because we knew it was going to come, hopefully, or we wish.
Well, it's okay on one side, and the other side's like, oh my God.
Well, up to a point, right? It's like, I don't think I could do this for another year. But, fortunately, it's worked out to this point, and so, we're just going to keep doing what works for us. But the goal ultimately will just, to probably expand the practice. And, put satellite offices where we need to reach patients that will be beneficial. Kind of up and down the seacoast, there's a big void up through Maine and even further south. So, right now I'm going to Frisbee and Wells, work out of those hospitals, the wound care centers, and then down at Exeter as well. I have hospital privileges and for the hospitals and just trying to build a good rapport with other physicians. And we have about 20 or so plus physicians that we get referrals from. And I would anticipate over the next couple of years, that's going to triple, quadruple, and so on. Especially as, we build the reputation of what's important to the patient and how we can be, of best use. So.
Port-ortho.com. Please go check out Portsmouth Orthopedics. John, I wish you very much the best of luck with the future of your business here and your ability to help people. Reach out if you just contact. I'd say that across the board. Most healthcare providers in the state want to help you. If you have questions, speak to them. Speak to your insurance company. Speak to the VA. If you're not sure what to do, there are people out there to help. A lot of people are scared of diving into everything that's involved with this, but if you ask questions, there are people out there that want to help you out, so please do that. Thank you to Citizens Bank for obviously supporting these businesses. Citizensbank.com. I'll link in the episode description if you want to learn more about the grant program and as well as for Port Ortho. So, John, thank you so much for your time today.
Thank you, sir. Appreciate it. It's been a pleasure.
NewEnglandTake.com to get more from me. Subscribe and like on YouTube, and we'll talk to you soon.